Hello, my name is Jeff Petersen with Petersen Physical Therapy. We're going to talk today about TMJ, temporal mandibular joint. And it's a dysfunction, so some people call it TMD. And it's basically your jaw joint creating pain. It can create headaches. It can pop and snap. Sometimes in the worst cases, it can actually get locked because your TMJ, your joint, has a little meniscus in there, just like your knee, and sometimes it can get trapped. And it can be really difficult. And I've been practicing long enough. Back in the day, they used to do surgeries to correct it and reposition it. None of it worked. A physical therapist from Peru, was he from Peru? Roccabato. He learned that what was going on with TMJ was it's actually a hypermobility. There's too much mobility in the joint. There's a continuum of mobility. Hypermobile can go to the point of pathological hypermobility. If you blow out your ACL, you need surgical repair or at least a bracing, or surgically fused or pathologically fused. And then right in the middle is normal. Some people tend towards the hypermobile side. And there's a continuum of that hypermobility. There are conditions called Ehlers-Danlos, which is about 15 different conditions of hypermobility. We've been treating mobility in terms of hypermobile versus hypomobile, meaning not enough mobility, for years. And inevitably, the people that we see with chronic TMJ are the people that have a lot of mobility. So there is a test that we take them through. I used to call it the Roccabato test. Now someone calls it the Biton. But if you Google it, it might be Brighton test, but it's all the same test. So we're going to have Karime demonstrate this for us. Okay, so the first thing we want to look at to assess where Karime falls on the hypermobile scale is to take her through some tests and just look at her periphery joints. So if I look at her knees, do they hyperextend? If they both hyperextend, that's 2 points. She does not hyperextend, so she gets 0 points. The next thing we want to look at is her elbows. Do her elbows hyperextend beyond 10 degrees? That's a yes on this side. I've already checked the other side, so that's a yes. So that's 2 points. Okay, so then we're going to look at her thumbs. So let's hold up here. Touch your left thumb to your left forearm if you can. So that touches, that's yes. Now we're going to do the right side. That's a yes. Okay, good. Now we're going to look at the little finger. Palms up this time. Let's do this one so you can see it to the camera. This one here, we're going to see if this one hyperextends beyond 90 degrees. And yes, it does. A little painful there, but I'll give her a yes. So we're going to give her 4 or 5 out of 9 for the hypermobility scale. So that means her joints have a tendency to move too much. Does your jaw ever pop? Mm-hmm. Yes. So she's in physical therapy school, her jaw's popping. So we've talked in other videos about posture and about tension headaches. It's important to look at your posture. So Karime has impeccable posture because she's in physical therapy school. But one of the things I notice is her shoulders do come forward just a little bit, some tightness in her pecs. So what we're going to subscribe for Karime is, pulling these shoulders back, is some strengthening in her upper thoracic area and really being cognizant of her posture, watching what she eats so we don't take daddy bites is what we call them in my house. Because when you take a big old bite and you open your mouth wide, she's not going to chew gum. Chewing gum anymore? She's not going to chew any gum, and she's going to be really careful about how she chews, and she's definitely not going to rest. Let's show on this one. She's not going to sit on her desk resting her chin in her hand. If you speak Spanish, this is called no bueno. ¿Hablo español? Mm-hmm. Yeah. No bueno. When you see people doing this all the time, you're pushing on that jaw. The other thing is sleeping on your side with the weight bearing on your face. It shifts your jaw. So that's going to stress your jaw. If it's already moving too much, it's going to stretch it beyond its capacity to stay in a normal position. So that's the most important thing with TMJ, is identifying your mobility, watching your posture, and strengthening those muscles. Now there are other things we can do for an exercise. So now we're going to face the camera this way. So the most basic one is tongue on the roof of your mouth. Like this. And then you're going to open and close against the resistance of your mouth, tongue. So now she's going to try to close, but her tongue is giving her resistance. Can you feel that? So let me see you do 10 of those. There you go. And then close. And open and close. Keep that tongue right on the roof of your mouth, and you're closing against the resistance of your tongue. So look at me here. Let me see you do that. You can do that right in front of the camera. The biggest obstacle to doing these exercises, they look silly. So if you have to do them alone, you don't have to do them on camera, but you're going to do them on camera for us. Let me see you do it. So tongue on the roof of your mouth, open wide, and then tongue on the roof of your mouth and close against your tongue. Close, 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 and open. Close and open. Look at me. So one of the things with hypermobility is people lose joint awareness. Have you ever had a pair of socks that just stretches out? So the way we maintain stability in a joint is not just the ligaments being tight, but when there's tension on the ligaments, the nerves fire and they tell the brain where everything is in space. So part of training the TMJ is to train it to move in a way that's what we call physiological, or how it's normally designed to move. So we're going to practice this. Tongue on the roof of your mouth, and then we're going to close against the resistance of our tongue. And we're going to do 10 repetitions. You ready? And go. And that's 10, okay? So we're training that. Now, Karima has a little bit of a challenge with this one, but she's been starting to get some TMJ pain, so she's going to do this one every day along with maintaining her posture. The other exercises we showed in the video on tension headaches. Let's have you turn around this way. And it's basically to strengthen the muscles throughout the neck and the upper trapezius to hold her in a good static posture. We would also, for patients that have TMJ, work on core strengthening and hip strengthening to stabilize the base from which we're working. Keep in mind that our TMJ hangs on our skull sits on our spine, so this joint is hanging freely. We'll have you face the camera again. So you're going to open your mouth and just let it hang a little bit, like you're catching flies. My mom used to say, "What are you, catching flies?" So if I dip her just slightly this way and let her jaw hang, what's going to happen is gravity is going to pull it to the right. Now try closing your mouth. You feel the crossbite you get? Yeah, so what happens is you can get a crossbite where one side hits sooner than the other simply by dropping your ear to your shoulder. Now let's come this way here. Now let's have you stick your head out like in a forward head posture. If we stick our head out, our jaw hangs and it's going to hang back. So now I have an underbite. So we can affect the bite simply by changing the position of our head. So hypermobility in the cervical spine, hypermobility in the joints of the jaw, all impact TMJ. So it's a comprehensive treatment plan, but hopefully this is enough to get you started. If you've plagued with TMJ and it won't go away and this isn't helpful enough, by all means, see your physical therapist. Thank you.